Folding inside the eye. That's a 12 millimeter length, and I am putting it into the back. So right now we replace the cataract. The surgery is done. We're gonna aspirate the viscoelastic fluid and leave the anterior chamber with liquid, and then we're going to start the retinal surgery. So we're going backwards with the eye and we do the retinal surgery. The viscoelastic fluid is being aspirated from the anterior chamber. Everything is clean now. So since these incisions are so small, we don't need to put sutures on it. We're gonna put water on the edges of the wound, and this water in the edges of the wound causes an edema, localized edema, and this edema closes the wound without stitches. So that allows us that, you see the eye is ready, no stitches, and the surgery is ready. So right now we're going back to the retina. Through the sclera, we're doing small incisions, 23 gouge incisions through the sclera. They're called sclera ports for vitreoretinal surgery. So we're getting right now into the 5/6 posterior 5/6 of the eye, where the vitreous body is and the retina is. So we already did the anterior segment surgery, and now we're going back behind the pupil, behind the IOL we just put in, and we're gonna work with she's a diabetic patient, right? So the vitreous, the eye is full of blood because of diabetic retinopathy. We're gonna clean all this and hopefully help her with the retina. So this is the infusion port. You see, through this port we're going to be providing liquid inside the eye. 3 ports, side ports, liquid inside the eye, so the eye is going to be always with pressure, with intraocular pressure, and allowed us to work inside. So we're going to change the setting of the microscope from anterior segment to posterior segment surgery, moving some issues here, changing the focal distances, changing the lenses. This is the 128 diopter lens that allows us to do retinal surgery. And when I put this here inside, so there are some lenses, and all the computer system change the microscope to posterior segment surgery. So that means that the pedal, the foot switches that I have in my left foot will be the same, but with a different function, since I changed the setting of the microscope right now. So this is a special LED light. We put it through this. He tries if the vitrophagus is working. ¿Está bien? So we put the light inside the eye. There are very small incisions, but come down.
Yeah, and more.
Mm-hmm. This is a very small, these are very small ports also, so they don't need stitches. When we take everything out, they don't need stitches to do it. There it is, there is the retina. You can see the optical nerve, the vessels, the membranes, all these gray membranes are over there. That is because of the retina. That's just a retinal detachment with membranes and everything. You know, because when the patient has diabetic retinopathy, the eye bleeds inside, and all this bleeding detaches the retina. So we're gonna start the surgery. We have two tips over there. You see, one is the light, the other one is the vitrophagus. So we're gonna illuminate, and we're gonna heat all the vitreous body from the eye. Through one port is liquid coming in. Through the other port is everything going out. What you see here in the middle, this is the optical nerve. This is the optical nerve. This structure, what I'm showing you there, has 1.5 millimeters diameter here. So you can see it as big as that. And these vessels here, they have 250 microns. So what we're doing here, this is a brain, because retina is considered brain. So we're doing, what you're seeing right now is the inside of the eye.
Microphones are just gets an extra sound.
You see all this silver reflex of our membranes inside over the retina, shaking. So we have to remove all these membranes carefully. So we'll make a hole in the membrane. You'll see how I move it. And you have to, everything is stuck over there, glued over there one to each other. That's called peeling. I'm doing the peeling of the membrane with the vitrophagus.
Yeah, it's just near him. It's like he's here.
Yo siempre empiezo del lado donde sale, ¿no? Vamos a cambiar un poco la dinámica de traducción aquí. So, this is, we are trying to release the retina from all these membranes that are, you know, really attached. If they grow up there, they really attach to the retina. As you can see here, these are bleeding, small bleedings here, and that happens because these membranes are so strongly attached to the retina. You'll see kind of how I move them. They're so strongly attached that when we take them out, the retina, all these pathological vessels that grew up there start bleeding. Okay? Dame un momentico una pinza de retina.
Miguel. Pinza. ¿Tienes algo más?
¿Tiene?
Sí, ya, no.
Oh, forget it. She can get the equipment and get it. She got it figured out.
Es como lo que podría, no.
Mientras, esta no es bueno, buscamos nada. Can you see in the monitor what I'm doing, right? This is
No es limitante.
You can watch it now.
Tengo la mano.
chévere.
20 minutes.
Vamos a darme el vitrófono primero y después seguimos con los... This yellow part here is called macula. So this membranes, as you can see, they are over the macula. This here is the ILM, the internal limited membrane. You'll see it over there, how I move everything there.
Hacemos de la botella, ¿no?
Sí, alzar un poquito. Me parece bien. Claro. Hacerlo por un rato y después la bajas a 20. So I'm going to show you, this is the macula. And that's the optical nerve, as I told you before. Préstame la pinza. So this here, we're moving this space here that's 3 millimeters wide. So this is the membrane. You'll see how I take it with my hand, and membrane is firmly attached to the retina. We have to take this membrane out so the patient can see.
No, it also would be easier to stitch this one with his. You guys kind of like And if this one comes out, this one's for us, this one, we lost the first time, and wouldn't connect. It's harder for good and faithful every time we see things. She has been good for 5
That's what I'm
years.
saying.
It's like 4 years. Overheat? I know. Yeah, it's because it's trying to. There's a other one more stable than that. It's again, it's trying to cancer. That hasn't been last time too. I think I have a lower whatever you should get.
Me parece que hay un arreglo, ¿no? Okay, this part of the membrane and retina, it's free right now. Mira cómo sangra por todos lados. Sube la presión.
Sí, me dice, seguro vos. 35, 30 por
All you have to do is sit there and watch him. It's not like, yeah. You see it turn on.
que en algún momento se va a romper esto. Sorry, Rita. Necesito cortar el camino. Okay. That's what you see there moving is the retina. Ya se cortó. Okay. So now we clean all the membranes inside, basically big part of them. So vamos a mejorar la córnea. I'm going to show you how this is the magnification we use, so you can imagine how small things are inside the eye. Vámonos a... ¿Tienes un poquito de perfluorocarbono? No. ¿Dónde estaba la regla? ¿Aquí?
Bien.
Sí.
Un poquito de perfluoro.
Ay.
¿Dónde? ¿Aquí?
Ay.
Dame el software, porfa, un momentito. There it is in pocket. Aquí, ¿no? Aquí hay uno. Creo que aquí había, ahí está el otro, ¿ok? Muy bien, entonces vamos a... These white lines you see the white lines over there? These white lines are blood vessels, clotted blood vessels. Okay? Toma, vamos a poner perfluorocarbono. Y vamos a poner aire. Después. So, right now we're injecting special liquid, heavy liquids. It's to flat the retina. It's called perfluorocarbonate liquid. Vamos a empezar por el nasal y después bajamos al otro, que es más alto, ¿verdad? Ahí. This is used to flatten the retina, and then now you see the nerve, the macula. Vamos ahí. We're gonna inject air in the eye right now. See el dedo entrar. Gracias. Ahora sí. Okay.
¿Cuál es la idea? ¿Así, no?
Sí.
Sí.
Espérate, yo creo que
No,
sí.
no.
Espérate, yo creo que sí, pero dame 30 segundos para
Sí, sí, sí.
decidir. So right now I'm filling the eye with air. That changed the refractive media, and you will see a panoramic view of the eye. It changed drastically or dramatically the this is like a wide angle right now. Okay, good, and ando por aquí. Okay. Y el otro estaba aquí abajo, ¿no? Como aquí, ahí. No, no, estamos cerca, pero okay, we took the, let's clean this. Vamos a ponerle más viscoelástico un poquito. Bubbles coming out from the eye. Touch the lens and so right now the retina, it's flat without the membranes. Aquí, ¿no? Voy a poner los ojos, voy a dejar ¿verdad? Okay. Well, the retina lays flat right now without without membranes and everything. You see, it's much better. This is the optical nerve here. These are the vessels, the macula. If you want to take a look through the microscope, you see the difference in quality of vision?
Yes.
Quédate así, inclínate hacia acá. No, inclínate hacia mí.
Bien.
Without, yes. You can do focus, muéstrale dónde enfocar. Here. There. Without touching nothing green. You see?
Mm-hmm. You wanna see?
You wanna see?
Sure.
Don't touch things. Down here. You see the difference between you see there, outside here. I think it's good. See? That's nerve vessels and macula. Who else wants to see?
You wanna see it, Timmy?
Before we
Yeah, sterile.
this is the nerve.
So it's like,
All set? Who else is in the line? ¿Quieres echar un vistazo adentro o no? Prepárame el láser.
Sí, lo dejamos todo. Listo.
Este es el nervio óptico. Este es el nervio óptico y estas son las venas, las arterias y esta parte central se llama mácula. Aquí yo estoy tocando el nervio óptico. Cuando yo toco el nervio óptico, yo estoy tocando las prolongaciones. Esto está a un par de centímetros del cerebro. ¿Ves? Esa es toda la retina. ¿Ves por qué tenías que haber estudiado medicina y no ingeniería? ¿Te gustó?
Gracias.
De nada. So, now we're gonna do laser. We have different types of laser for different things. This is green laser. Five hundred 135 nanometers. That's the wavelength. I don't know if you know what I'm talking. Of course, you know what I'm talking about, right?
Yes.
this tissue has pigment, and this pigment, the laser, the light of the laser is being captured by this pigment and burns that tissue and or increase the temperature. So that causes a scar that attach the retina from behind the retina. This tissue is getting heated. It's heated by the laser, and that causes a scar, or yes, an inflammation and a small scar that attach the retina. So this is called pan photocoagulation. I am putting laser all over around the retina, saving the macula, saving the optical nerve in the macula, not burning the macula and the optical nerve. But this helps also to redistribute the blood flow. So since in diabetic retinopathy, the blood vessels are occluded. So these are 250 micron vessels, that less than 100 to 150 microns blood flow, and their retina doesn't get enough oxygen to live, the cells to live. So we are burning, and we are, killing this rest of the tissue. So the blood that gets into the eye will help the main part of the eye, which is the macula, because our vision, the central vision that we have is 20. Our vision, when I see your eyes, my I see your eye, is this part of the eye, the macula, that part here that calls macula, that sees your macula. My macula sees your macula. The rest of the retina is for the peripheral vision. And we are burning all this retina so we can focus the blood flow that is still there to feed cells in the macula. So the patient will remain with some vision till the last days. See, that's why I'm doing laser all over around. I'm condemning this retina to help blood flow to focus on the macula. No, my pleasure. So you see that these white spots are laser.
You're burning it, right?
Yeah. In this case, we had this membrane grew up over the retina, and lifted the retina, and there was a lot of fluid between the retina or under the retina. So we had a retinal detachment, diabetic or retinal detachment all over around. So first of all we took out the vitreous body, then we did a